Fasano, thanks for being with us today. You know, the first thing I want to talk to you about is drugs like aspirin, ibuprofen, or Aleve. They're all pretty common, right? So looking back at studies over the past 20 years or so, didn't we already know that products like these can be irritating?
Yes, good morning, Betsy. First of all, drugs like this that when are taken for a prolonged period of time can eventually irritate the intestine. The intestine is covered by a strata of mucus that is protect us against, invaders from the environment. And these drugs, they really deplete this protective mucus, make intestine leakier. So theoretical friends like foodstuff can come through undigested, can set up an immune response if you're genetically predisposed like celiac disease or gluten sensitivity.
So that's how it works when it comes to celiac disease. It kind of destroys the lining and it leads to the disease or maybe gluten insensitivity?
Yes, indeed. Under normal circumstances, there are a lot of substances that come through our guts. Some are friends, like foodstuff. Some are foes, like bacteria can harm us. But even friends, like proteins from food, including gluten, when they come through undigested, can set up an immune response. They can lead to collateral damage that we call inflammation. And depending who you are, if you're genetically skewed to develop an autoimmune response, you develop celiac disease or other form of reaction. So that's the reason why it's so important to maintain a good barrier function of the intestine.
So do you really believe there is a direct linkage between aspirin and ibuprofen to celiac disease?
I don't think that we have undisputable proof. Theoretically, prolonged exposure to non-steroidal anti-inflammatory drugs like ibuprofen and aspirin may increase the permeability of the gut. We know that it's a crucial step to develop celiac disease. So at least in theory, technically it's possible, even if we don't have, well-designed, prolonged studies that will prove that that's the case.
Well, here's where the problem lies, because one study also shows that these drugs can cause damage when taken in conjunction with exercise. So explain to us how that happens, because a lot of people do exercise regularly, and they need these drugs to help control the pain.
Sure. Exercise, particularly prolonged exercise, is well known that can increase intestinal permeability. Matter of fact, it's a byproduct of prolonged exercise, as we had yesterday, for example, with the Boston Marathon. That's well studied. Now, if you add on top of the prolonged exercise the use of these drugs, now you have an additive effect. So you have the double digit, if you wish. That will increase even more the permeability of the intestine, put you more at risk. But I want to stress the concept, though, that we're talking about prolonged exercise and prolonged use of these drugs.
Okay, all right. So don't be too alarmed just yet. We see somewhat of a linkage, but it's not a definite at this point, you say.
I completely agree. So what I'm trying to say is, if you have a regular exercise, as everybody does, as should have, and once in a while you take, painkillers because your joint aches, that will be just fine. But if you exercise strenuously, for hours a day as professional athletes, and regularly you take this non-steroidal anti-inflammatory drugs, that can be a problem.
All right, Dr. Alessio Fasano, breaking it down for us. Thank you. We appreciate your insight.
My pleasure.
Still ahead, the upcoming test for